Welcome everyone to the training webinar series Eyefinity Encompass Take Control of Your Administration Settings presentation. Thank you for joining us today. We look forward to your questions throughout the presentation. You can enter them by clicking on the Q&A icon on the top of your screen. My name is Linda Park, and it is my pleasure to be with you today to introduce Tammy Lynch. Tammy has more than 30 years of medical billing experience and holds a Bachelor of Arts in Business Administration, as well as many certifications in software development. She's trained at our Eyefinity education conferences, on-sites, and hands-on sessions. In her spare time, she enjoys spending time with her family, traveling, spending long days on the beach, and watching college football. She's known for her patience and flexibility. Welcome, Tammy.
Thank you. Let's see. So if you can tell me, Linda, when you can see my screen, I'm going to stop sharing this. Kind of move things around. There we go. All right. And then I'm going to reshare. All right. Are you able to see my screen now?
Yes, I am. Thank you.
Perfect. Okay. Well, welcome everybody. Thank you for joining. Today we are talking about administration settings in Encompass, and I want to start with one key idea. Administration is not just setup. It's really your control panel for how your entire practice runs. Everything we're going to look at today impacts one of three things: your revenue, your efficiency, and your billing accuracy. So as we go through this today, I want you thinking what's happening in my system today that might actually be driven by admin settings. You're going to hear me I don't always, it's administration, but I'm going to refer to it as admin, kind of what I'm used to shortening that. So we are going to go through some admin settings. We get a lot of questions regarding things related to admin. So what I want to do is I want to go through and I want to just kind of hit on some of those questions as we walk through. I am opened up into my Encompass instant, and the first thing I just like to tell everybody, there are two ways to get into admin or administration. Bottom left-hand corner in almost every screen in Encompass, you have this little blue hyperlink that will take you into administration. Some people don't know what's there, not a big deal. They like to come back to this home screen and they like to click on the tile administration. So they take you to the exact same place, no matter which one you click. I'm used to clicking this one, so I'm going to click down here, and it is going to open me up into my company setup. So I can see I'm in the company setup. It tells me up here I'm in the company setup. For those who have multiple locations, if you scroll up and look at office configuration, you will see your locations. So in my training environment, I have two locations. I have Surfside Optical and I have Ocean Vision. So at any time, I could just come down and click on one of these. Notice that I'm logged in as T Lynch, and this here number is where I'm logged in here. I could switch and go into Ocean Vision if I wanted to, but we're going to stay here in this one for today. And we're going to walk through as much as I can get through. Admin, you could probably spend 3-4 hours. We don't have that much time, so I'm going to try to hit the high notes. And like Linda, if you have questions, pop them in there. If we can't get to all the questions, I will take the questions with me after the session and I will email those answers to you. Okay, so let's just start. I do like to kind of start with the company information. Again, I'm not going to go through all of this. I'm assuming majority of this is already set for you, but like I said, we get questions from people who have been using the system for 5 years. Maybe they've got new employees or a management switch. I just like to jump in here and just point out that down at the bottom is where you can put a logo. So we get asked a lot of time, where do you put your logo? This is your company logo. You can put a different logo on your location if you wanted to. Hence why we don't have a logo here, because we have them embedded up here. And we'll look at that here in just a few minutes. The other thing I get asked a lot about is the tax. So I just like to point out that there is tax information here. There are two spots that you need to fill out, and this is one of them. And it's this little blue review button here. Sometimes it can be easily missed. That's where you would start. My other thing that I get asked a lot, or I see on Facebook a lot, like my Eyefinity keeps logging me out like every 10 minutes. There is a security setting if you did not know. There's a timeout and there was a password policy. If I click in here, this is set for 60 minutes, but I can go as low as 2 minutes. I can go as high as 120 minutes. So just to know that this is in here and it can be changed. Same with your policy password. One upper and one lower, 90 days, one upper or lower, 90 days. Most people will jump for the one that's 365 days. Again, the only difference is this and sign or the or sign, how you want to set up. How often do you want your password to expire? And you have to reset it. Okay. While we're on this page, notice these little boxes with the question marks here. These are like tooltips. So I'm just hovering over away from it, hovering over, and it's telling me what that particular field is for and what it does. Just gives me a little bit more information. And you will see these throughout the entire Encompass software. It's all up in there. If you ever don't know and you see a little tool, just hover over it and it'll let you see there. Okay, so that's the company. I'm going to click back up here to my admin home here and flip me back to this front page. I'm only going to stop at this integrations tab for one quick second, just to tell you, be very careful. This is what integrates. I also have EHR. So this is where my integration to EHR is happening. It makes it so that anything that I do in EHR, if I want to send an RX or send charges or send exams, fees, it knows which one it's coming from. So it knows to put it into my location here. The only thing I like to point out, well, first I'm going to say never, ever, 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 ever touch any of these numbers unless you are 150,000% sure that you need to change it, because this one of these changes could really stop that integration from EHR and this system here. So be very careful. But those of you who do need to go in there for some reason, update it. This is one of the pages, there's two, where you see this edit button. So I'm clicking in here, I can't click, and that's done purposely so that you don't change anything. But if something needs to really get in there, you can click on this edit button and you get this big warning. Basically, are you sure? And it tells you any values on the screen, you can break your integration. If somebody truly, truly needs to get in there, they click this, I understand the risk. And now you can see these boxes. I hate clicking in here, but they are open. And then you can get in, make changes and hit your save button. But generally, you're probably not going to come in here. This is all going to be pre-set up for you already. But if for some reason you find that the integration is broke, or you feel like something's not right, it's not pulling over, you could look here, call in to support. They're going to look to make sure that everything is set up. This is one of those. Okay, so back to this homepage, just very careful on the integrations tab there. I do not want to save that. Okay, so two. I'm going to come over and just touch on these just a little bit. Everybody, this is where you would add in your providers. When I click in here, these are our providers. We are a test environment, so these are not actual providers, but you can see they're logged in here. If I click on their last name, it gives me more information here. This is where their setup is. If the doctor wanted to add their electronic signature, this is where they would do it here. They can crop it, make it active. I'm sorry, doctor, if the doctor leaves the practice, you can mark the doctor's inactive status, but your logo, or I'm sorry, your signature would go here. Their licensing's over here on the right-hand side. And then works at offices, this would be where they're tagged, what offices they work in. You can see we do have red asterisks. So red asterisks in the system means that it is a required field. So default minutes, something has to be in there. This is the doctor where they're going to put their default minutes. Same thing with overbooks. Notice we have a little tooltip. If this doctor would allow overbooks on his schedule, you can actually put in here, maybe he'll say, I'll take 2 overbooks. So you can put 2 in there. Here is another Eyefinity EHR. Again, I'm going to hover over it, and it says this is the identifier for this provider. So again, you don't want to really mess with anything that is Eyefinity EHR here, because you could actually mess with the integration. So be very careful. If this doctor has online scheduling, you're going to click that button. If you're doing electronic patient notifications, you're going to check this box. Okay, I'm going to hit save. So that was just clicking on the doctor's last name. As I come across here, this would actually be real NPI numbers for the doctors. This is one place where the doctor, you could change their schedule. If I click modify, here's Dr. Jonathan, Dr. Barfield's schedule. So I can see they're available. He's available on Monday, Tuesday, Wednesday. He's not available on Friday. But if he says, yep, I'm going to work a half a day Friday, one place you could come in here, maybe you're just going to work a half a day. And let's see, let me get it. There we go. And you could add the availability so that he works Friday. Same thing with Saturday. If he says, you know what, I changed my mind, I don't want to work on Friday, I can go in there and you can remove it. So one place where you could update the doctor's office hours. Up here for resource, this is where you could change. So maybe you need to change the hours of the pickup calendar, or Dr. Law, or doctor test conference. So all of the doctors or your resources are loaded up here. One place again that you could come and update their resource schedule. Okay, I'm going to click out of here. Security, because I don't think I have access to here. Oh, I do. Okay. So security, this is going to be the access that the provider has for Encompass. This is where you could grant all access. And if you look, if I click this button, it's going to put checkboxes next to everything except security. One huge note that this is probably one of our big questions when it comes to the security section here is this looks like it ends. But if you look over here, there's some extra white space here. If I pull this bar down, and usually it's the printing of the RXs, if I pull this down, from right here, this is additional that you can't see. So our number one question is, I can't print an RX. Why can't I print an RX? And we're like, do you have the security privilege? That's not on there. And this is the first thing. So this is where they log in here and they're looking for it and they can't find it. And then we're like, oh, there's a gray bar on the right-hand side. Roll that down and there is your print RX. So there's a couple of things. It's not hidden. It's just the page is long. So you just have to kind of move the bar down there. Security privileges are going to be for those who want to be able to reset passwords. You could come in here and click it. Again, got little question marks that will give you a little bit of information, extra information. Same thing with what's the billing dashboard versus the operations dashboard. So little information in here. Then I'm going to hit save, and you can pick these too. I mean, if you don't want this person to have access to inventory, you just uncheck it. Okay, I'm going to hit save. And these again are providers. So this would be all related to the provider. Insurance details. I'm going to click on here and I'm going to highlight this because this is the easiest way to explain. There's a little note in here. If any of your third-party insurance carriers are credentialed with an individual NPI, please enter the individual NPI for each carrier. So you don't have to go to those individually. This section in here, I can click this plus add button and I can choose, there's carriers in here. Let's just use Medicare for an example. NPI type, let's just say it's a group. And legacy ID, again, if you hover over this, it's not going to appear on the CMS form, and it kind of gives you that information there, what that is. This is where you would put the rendering provider NPI. This is where you would put the tax ID number. And if you wanted to, I'm going to hover over it again. It would appear on line number 25 of the CMS form. So when you see these little numbers behind here, in the parentheses, that usually refers to what line or what box on the CMS 1500 form it will appear on. Here is the provider billing information. So this would be in box 33, and you're just choosing which one's appropriate. And then here is the billing NPI on 33A. And then this is the box we get asked a lot. Well, where do I put my taxonomy? Right here. And you would pop it, and that would populate 33B. And then you would just hit save. Now, your insurance carriers, you would have the list here. You would go through which insurance carriers, because they're probably not all going to be exactly the same if you needed to. And then you would just hit save. And red asterisks, like I said, are required information. It's not going to let me save this. I'm going to hit cancel to get out of it. Okay. And then resetting passwords for doctors. I'm going to talk about resetting passwords in the staff setup here, but the resetting passwords is available in here. This is your little button up here for VSP providers. You can click this button to fetch provider information for your office. I don't know yeah. So you would just kind of come in here, get the information and add it, save it, and it would automatically populate in here for you. Okay. Gonna go back. So staff, very similar. It is very, very similar. Looks a lot the same. I'm going to keep using Jonathan as my guinea pig here. So same, it looks exactly the same. Nothing's really different here. You can put license numbers here. Here is where, again, which offices does Jonathan work in? Default minutes, even though this is staff, so we are not in the providers anymore, you still have to have something in there and allowing overbooks. And the staff would probably still have an Eyefinity number. If you want that staff member to have a calendar, maybe they are contact lens dispensing or an eyeglass, they're responsible, you can click it and add a schedule for them. These usually are grayed out. They're not usually for staff. These were just for the doctors. Okay. I still have the ability. So I can tell here, none of our staff in here have a calendar. So it's grayed out for me. So I can't. If there was somebody, like I said, who had, maybe they were doing a contact, they were in charge of a contact lens pickup calendar or some kind of fitting calendar, you could add a calendar. This would be highlighted and one place where you could go adjust the dates and times that they're available. Security looks exactly the same as it does for the provider. Same thing exactly. I'll pull down and you can see down there are those extras. So nothing's changed in here. This is where you will hear a lot of us say when somebody says, well, I can't do that, I can't see that. Do you have the security access? And you can kind of read through, there's some front office, editing patient insurance, for example, inventory, claims management, and then all of these transaction ability, ability to give a refund, process refunds, ability to reopen the daily close types of things, and then admin, and then reporting. So same exact thing for providers and staff for here. And then I want to I'll use myself just in case something goes crazy here. Currently, when you log in, you have your login and your password. If you lock yourself out, we encourage you to come up to the upper right-hand corner of your screen and choose security questions. When you choose your security questions and you accidentally lock yourself out of the system, by knowing you have to know the answers to the questions, your security questions, you can unlock yourself without having to get an administrator or a provider or somebody else to do it for you. So we always encourage you to update your security questions. Maybe you updated your security questions and then you forgot the answer. Then maybe you do need an administrator to reset your password. The way that they would come in and do this is they would come in here and they click on the little button that says reset password. When you click reset password, it is going to give them this. Sometimes it's letters, uppercase, lowercase, sometimes it's numbers. This is your basically the I'm not going to do it, but the person giving you this would hit save, then copy and pasting this and sending it to you. And then when you go in, that's going to ask you for your password. You're going to use this temporary password. Once it opens up, then it's going to ask you to change your password. So that's what they're doing. If you get this really weird, doesn't make any sense group of letters and numbers, to reset your password. Okay. I'm not going to reset my password because that will lock me out of here. I'm going to go back to my admin home, and then you can see here office resources. So office resources, you can see we have the contact lens pickup. These are probably, this is a training environment, so supports in here kind of testing it for us. But here's my contact lens pickup room. I can modify the resource schedule here. So remember, there's a couple of different places that you can modify schedules. When I click it here, it looks exactly the same. And I do the exact same thing if we decide that we're going to be able to pick up on Thursday from 9 to 10. I can simply come in here and I can add or fill the availability. I can also right click and do it too. Yeah. So, and just another place where you can add that on that resource page. Okay. Nothing really else in here. You just kind of add your resource, and you can look up names. There's only 3 here, so I wouldn't really need to look these up. You can inactivate them. If you wanted to see a list of ones that were not active, you could click the little uncheck the button and hit search. We don't have any that are inactive. So, okay. Office resource. So I like to point this out. These are tiles. I use the tiles sometimes. You can use the tiles or you can use the drop down menu. So kind of what I want to just point out is you see this word resources. And you can see down here billing and MVC, and you can see products and services here. They all are up here also. So as I'm going across resources here, we just talked about provider, staff, and office resources, but I could have also come up to here. Now, there's not a lot of space on this page, so we couldn't fit everything, all the tiles. So notice in here, it's in order, provider, staff, office resource, plus this is your outside provider resource. So we don't have a tile for it, but you can still get to it by clicking up here. Outside provider setup, very simple. These are the doctors that are giving prescriptions to patients. And for whatever reason, you might not have seen them as a patient, but they want to buy eyeglasses from you or contact lenses from you. They saw something in your shop that they wanted, so they want to come buy them from you. You're just kind of clicking here. This is where you're adding them. It looks a little similar also to the provider setup. You're just filling out all the red asterisks. License and provider NPI are required. I do get a little bit, sometimes offices are telling me, well, it's not always on the RX. I have to go back and look it up, but I'm in such a hurry. I'll tell you this little short secret that we tell. For these red asterisks, you can put like all zeros in there, save it. It'll let you save it because it's only looking for the amount of characters. It doesn't know that it's right or wrong, but at least it allow you to save it and then go look up the information, find it, and then come back in here and update the screen. So little shortcut area for you so you don't get stuck doing that there. And again, you can make these active or inactive. So again, I went up to resources. Let me go back to my home so you can see. I went back to resources and I have all 4 here now, even though I only have 3 available here. Okay, same with products and services. So you can see we've got what, 5 here. When I open this, there's a few more than 5. I'm going to go through just a few of these because in this stuff should be already set up, initial setup, but just little things that you might not know where things are pulling from, questions we get asked. Item types. So item types is where you're telling the system what are you allowed to take discounts on? Global discounts and line discounts. Again, we got these little question marks here that I won't read it all to you, but that's your global discount. So if you're selling 5 or 6 items and you want to just do a discount on everything on that invoice, that's a global. Your other option is line items. So maybe you're doing an eyeglass order, but you only want to give a discount on just the frame. That is a line discount. And the way this works is your item types are down here along the left. And then you're just checking the box. Yes, I will give a discount on the accessory, global or Align. And you can see down here in our example, we on the exams, we don't have it checked, so you cannot give a global discount on an exam. You can for a line item though. Same thing with miscellaneous fees. We have it unchecked and plans. So there's also, yeah, there's 17. I was making sure I was seeing all 17. So this kind of decides what you can and cannot do a global discount or a line discount on. Okay, this one, I'm just going to go straight back up to products now. Accessory setup, we get asked a lot of times, well, I sell this accessory, but you don't have it listed in Encompass. We have 14 listed in our training environment. If I want to see what's not listed, and this is everywhere in admin, I uncheck that active box and hit search. And now it is going to give me a list. There are 2,675 different options you can choose in here. They are usually alphabetical. ACC is the beginning for accessory. I do see a lot of times people like these words. Where I'm getting at is, let's say, let me find something on another page that's a little bit easier to look at. Okay, let's say flashlight. We're going to take this as our example. We don't sell a flashlight. Let's say we don't sell a flashlight, but we got this brand new, really cool toy or something that we want to sell in the practice. Maybe it's a new vitamin of some sort, and you want to start selling it in the practice. What you can do, we call this repurposing. So this accessory description, you cannot change. I can click in there. I can't even get my mouse to stop in there. But this box here is fully loaded. I can really actually take out, I'm going to hit backspace, and I can put in the name of the item. So maybe it's, I don't know, let's just say it's a new vitamin called the Encompass vitamin. And let's say that we sell it for $20, $20 a bottle. And I want to make this usable where my team can sell it. I'm going to check this little box that says active, and it's going to activate it as soon as I hit save. So I'm going to hit save, and I'm going to go back to my active, and I want to see, remember, this is what I do currently sell. Now, if I come down here, here is my Encompass vitamin. Now that I can choose this on an invoice and I can sell it. Ignore the only way you're going to see that where we have this ACC flashlight is if you're back here in admin. Patients will not see this. This will not appear anywhere. Reporting, you'll see Encompass vitamin. So ways we call this repurposing. The big thing is if it's something that you sell that you cannot find on the list, find something that you don't sell, repurpose it, rename it, activate it, and put a price in there. Okay, so that's my thing on accessories. Let's see down here. Contact lens setup. Again, your contact lenses should be already set up. The only thing I did want to point out here is for those that are using like ABB or one of those integrations. ABB does require you to have a cost in here if you want any free perks. If they're going to offer you free shipping, if you sell over $100 worth of lenses, that information in our admin would be pulling directly from the cost field. The only cost that really affects that you would personally have to key in is for contact lenses. Frame costs are going to come automatically through Jobson, but if you are integrated with like ABB and you're trying to they've offered you the free shipping with X number of dollars, that's where it's pulling from is whatever's in this cost field here. Okay. Eyeglass lens setup. The only thing that I will say, I'm not going to go through and show there's a lot for eyeglass lenses, but let's say a new lens came out. You would need to come into the standard setup and go into your style, find the new lens, or maybe you guys are just decided to buy or to sell a new lens. You're going to come in here, you're going to find the lens. So most likely it's not active, so you'd have to click your inactive box, search, find the lens that you're going to start selling. And then from here, same thing. You're going to put your retail price in per lens, and you're going to click the active box, and that makes it active. That is step number one, if you remember, for lens setup, your standard setup. Once you get that lens set up, you have to come over to the quick setup, and now you have to use that lens to set up the rest of your glasses so that your staff can see it in the front in the material order section. We always tell everybody, if you have a staff member who is like, I'm looking for this, trying to put together this eyeglass order, and I can't find X, Y, or Z. There's probably two options, two reasons. One of them, if it's not in the VSP formulary, you're probably not going to find it. But usually the one that is the most is that nobody came into this quick setup and added it to quick setup. So that's the first thing we always ask. Did you go to quick setup? Did you add it in quick setup? And 9 times out of 10, oh, I missed that step. So that's an important step for lenses. Make sure that you activate the lens and then go add it to the quick setup. And then your staff can see it in the front office. Frame setup. A big thing that I just like to point out here is frame setup. When I am in here, I am like looking for a frame. I'm basically just going to use Baby Beach since it populated. I'm going to hit search and see if we have one in here. This is back here. All you're doing is activating your frame and putting in your retail price. There's a lot on here. There is this little button here. If you just want to see which ones are active, I can click this and it'll narrow me down to just the two. So I don't have to look at a whole page. But yeah, these are active. This is my retail price. This is my cost, and this is the wholesale price. So I changed this so you could visually see. You cannot change the wholesale price. That comes in from Jobson, and that's how the insurance pays. But maybe you got it at a little bit of a better deal. You can change your costs. And again, we've got little tool tips here that are going to kind of explain which one. So this is what Jobson says it's the wholesale price is. This is what you paid, and this is what you're selling it for. Okay. This is the biggest part. This is not adding inventory to Encompass. A lot of people think when they come in and they're activating, they're adding frames to inventory. This is not. Inventory is a separate module. You have to go in and do an inventory, a physical inventory. If you had any of these in an inventory, your on-hand count would be red here. And if you have multiple locations and both locations have done an inventory, there would be a black price tag mark. You could click over it and it would show you if the other location had that frame or not. So big thing here, you're just kind of activating frames, pricing your frame, and then that's it. In order to find the frames in inventory, they have to be activated and priced before you can do inventory, or you're going to have a really difficult time trying to get your inventory complete. Okay, you can add custom frames in the system. Notice all the red asterisks. Everything on this page would have to be added. We do have bulk frames set up. Um, I I'm only going to cover what I like this section for is you can do these little cool price markups. I'm going to just kind of just show you. I'm going to use a flex on frame. It's on the 600 series. Let me just pop that one. I'm going to find it. I'm going to push it over. This is the one I'm selecting. Now I'm going to take this and you can do multiple frames. I'm just going to use the Flex on 600 series as an example. I'm going to come down here and what price do I want it to start at? Wholesale price, your cost, or the real price. I'm going to leave it at the wholesale price. And then do you want to mark up a percentage or a multiplier? And again, these tool tips are very, very helpful. Let's say we want to do a percent, and let's just say we're going to do, we're going to be very generous. We're going to do a 0.25. Do you want to add or subtract a dollar amount? So again, you can hover. And I was thinking yesterday as I was going through this, I'm not going to do anything for the dollar amount, but where it says, do you want to round up and end with a fixed cents? with the whole, I believe they're taking pennies away from us. I think they may have already, some places may have already done it. You could say, yes, I want to round to 00. That's up. And then here, price only active frames. So I only want to price the active frames. I'm not worried about pricing the inactive frames. And I can click that or not click it. I'm going to go ahead and click it. And then I'm going to hit preview calculation. I'm going to hit it. I'm going to move my hand off the mouse. Oh, nothing was found. Let me do it this way. Let's see if we can find something. There we go. I'm going to move my hand off my mouse because I can see there's 1160 in here. And what you're seeing here is the item name, the frame, the retail price, and then you're looking at the starting price and the new retail price. So there is no retail price because we don't have any Flexon 607s active in our system. But what it does is it's an easy way to mark up your frames. And I point this out. This is the one thing, it's not bad. It's showing me a preview here. Here's the thing is if I wanted to do this and I wanted to use these, I'd hit save and it would actually go through all 1160 and it would change the price. I do have to hit save here. I'm not going to, but this is where it shows you. I like that it shows you what it's going to do before it changes it. And again, you would just hit save and then it would change all those prices. I'm going to hit cancel. And that was under bulk frame setup here. Okay. So I'm going to go back up here, service setup. That basically goes back into all of your exams, your services. We all know that we cannot add CPT codes. We get asked that a lot. We cannot add CPT codes to the system, but you're going to activate what you sell. If you want a recall reminder, you can check it here so that the little box pops up before you guys are checking them out. You can assign the recall. Duration, if there's appointments, you can come in here and add the durations. If you want the last exam to update, you can do that, your price. And then again, same thing here. If I do like contact lenses, especially, or I'm sorry, fittings, 9. Notice here, here's the CPT codes, and you'll see like a 0.00, 0.1, 0.2, 0.3. If I'll start down here. Let's start at the bottom. So there's a 0.5. This is for contact lens fit, RGP, and hard. Same CPT code, but this is a 0.4. So the point represents what this is. So the 5 is the RGP, sclera for the 4, a 3 is multifocal, and so forth. That also defines your price. So obviously for the RGP, it's 175. For the sclera, it's 150, 175. So it's the same thing. Again, it's like repurposing. You cannot change the service description. You cannot change that wording, but you can change the wording in the service exam note. And I'm going to hover over and it reminds you, you can change the name and these names appear on the order and in the appointment scheduler. So instead of seeing it that says complex contact lens fitting level 3, you're going to see on the schedule RGP and hard. And that's what the system is going to show on the patient receipt. Okay. Other items set up, this is just going to be, I always point out there's 3 sections up here at the top. So shipping, repairs, and miscellaneous. So these are all have to do with shipping. Same thing, you activate repairs. You come in here. We don't have anything active. If I uncheck the active box and hit search, we have 21 different items we can look and change if we want. Same thing, you can copy over this and you can change it to what you want and you put a price in there and activate it. If there's a miscellaneous other item in here that you can't find, you can put it in here. Okay. And then miscellaneous fees here. These are all the other things here. We pretty much we have 12 active. If I come over here, there's a handful. There's 284 in here. And you see there's a lot of facials and things like that. If you don't use those would be perfect ones to repurpose. If you find something else that you need to add in there. Okay, so that's products and services. And I know we're getting close to time, so I'm going to run through preferences, big things that I think are important. The patient, under preferences patient. Um, we're not asking for title, email, socials, HIPAA. These are things that if you want those to be required, you would put the little check boxes there. Same thing for meaningful use. Those who use meaningful use would check this box, and that means all of these fields then become required with the little red asterisk. Scheduling preferences, eyeglass, default. This is the big one down here on this page that I wanted to call out. Claim management references. And it says allow claim updates with patient information changed in the front office. And there's a little question mark there. And I have it checked. So huge if you find that the patient had a demographic, maybe they updated something. Before, it wouldn't get to the claim unless somebody went in there, knew the change, and updated the claim. Now, this allows, whenever there's a change in the front office, this will automatically update the claim. And you might have seen it when you're in claims. If that does happen, there is a little yellow sticky that's at the top of the screen that basically tells you information has been changed, and you click on there, it'll show you there. So this is a good one, especially for billers, so they're not going back and forth and wondering why their claim didn't go through. This is very helpful to have this box checked here. Uh, Patient statements, this is just a way you can customize. This has come a long way. You can generate summary or detail. You can add on there what credit cards you would take that you want printed on the statement. Notifications, number of days after the last notice. If you want a logo, you can have a no logo or an office logo. You can decide which address do you want to display on there. You can do the company address or the office address, or you can add a custom address. So a lot of these things were not here a couple years ago. So we've really kind of grown this area to make these statements more customizable. You guys kept saying, how do we change this? Can we change this? So now we've kind of made it so that you can come in here and basically design it how you wanted to do it there, okay? Let me check. So that's your patient. Inventory, there's only three options really quick. Allow negative quantities, print the vendor name on the tag. We always suggest that you always do a scan inventory. If you're going to do an inventory, it's going to be quicker and much more easier for you to go through. Material orders. This is the one. This one has kind of grown a lot. Payment types. If you are noticing a payment type that is on when your staff is choosing and it's not one that you want on there, you can come here and you can inactivate it. If you decide you're suddenly going to take Apple Pay now, that's one that's been added. You can check the box and activate it. This is just for the front office when the staff is checking the patient out, they're choosing the payment method. That's these lists here. Invoicing. Checkout, if you want to do family checkout, you'll want to check this box. Minimum payment percentage at checkout. We want you to collect, I'm sure you want to collect 100%. This will show exactly 100% of what the patient owes. At the same time, if I owe $100 and I can only give you 50, you can still take $50 from me. It does not matter back here what this says. This is just going to prompt you to take this percentage from the patient. Auto exam posting, another big one. This is nice if you get your authorization for your exam and materials at the same time with the same auth. If you are set up where you do your exam authorization separate from your materials, this is not going to benefit you. What this basically does is when you're going through a material order, when this box is checked, if the patient also has an exam that's not been invoiced, it'll auto attach it to the material order. So it's a few steps less you have to do. But the key is one authorization for the exam and the material orders. On the fly calculations. On the right-hand side of the screen, when you're going through an order, as you're adding things for VSP, it's kind of following along with you and it's adding in the pricing and what the patient's going to owe before you even get to the end of the screen. So you can see right away as you're doing the order how much the patient is going to owe. So if you have a patient who's like, well, I can only afford this much, you have the ability to kind of play like, oh, well, if we add this, it'll be this. If we take it away and add this. So you're able to kind of look and see what that patient is going to owe before you get to the calculation screen and that. So you can do it where you can do exam only, or you can do it with exam and material. You'll just want to check which box is appropriate for you. Promise dates are here, custom invoices here. What do you want to display on those invoices? You're going to check here. And then the discount threshold. So if you are in an office where you do not want your employees to be able to give more than, let's say, a 50% discount, then you would type in their 50%. So that, not 150, 50. That is their threshold. So anything over a 50% discount would cause a screen to come up, a little modal that would need some override. If you leave it blank, there's really, they can do is whatever discounts they want. Those are just for offices who are tracking, maybe 50 is high, maybe 10, 15, anything over 15, they have to get. That's what that's doing there. Required notes section, if you guys are requiring notes. So basically here, if I'm going to do a miscellaneous payment, this is going to force a note. Why am I doing a miscellaneous payment? Why am I doing a return? Why am I doing a remake? If these are unchecked, it's not going to have the red asterisk, but the checked ones are. And there are reports that you can run to follow up on required notes. The only one under eyeglass orders is, do you want the frame modifiers in the eyeglass order? And that's a check. I believe this is specific insurance types things. It's not something that everybody has turned on, but now is a functionality in here for somebody needed it somewhere, one insurance or one. And then the QR code. The system's designed now. One of our last updates, you can put in your QR code. You would do that here. We give you the measurements and the sizes and those types of things there. Under billing are your insurance integrations. So this is where Gateway, AKA Trizetto. This is how you can, your whichever clearinghouse you can here. And then your VSP claim submission, which again, we always encourage automatic. Just to note, if you do flip this to manual, all your VSP claims are going to go on hold. Every single one, whether they're a clean claim or not. And somebody manually has to go through every one of them and mark them ready to bill. And then the system will come in and try to take them out. With the automatic, what is billable, what if it is a clean claim, the system will pick it up automatically. Sometimes you never even see it. If there is a problem, it's going to give you the issue. It's going to put it in the on hold bucket, and you're going to go fix it as you go through there. The only other thing I did want to show, well, when I showed you earlier, we don't have a logo in the company information, but if we sneak into the Surfside Optical location and I come to its information, I have a logo here. And underneath that logo is where we get asked, I don't want the PDs to be included on the RX. This is what controls that. It's not part of the logo. It's actually under. So if I want to include the PDs, I would check it. If I do not, then I will uncheck it if I don't want it on the RX. But this is our logo for our Surfside Optical. And then if I go up and I go into our ocean view, we have a different logo. So the reason we have them individually is so that if I'm in this location, I pull this logo, and vice versa with the Surfside. That is why we do not have one at all on the company, because the company will override both of them. Almost all the company settings will override the locations. So those are kind of little tips and tricks to make sure if you can't find something that you're walking through, making sure that that it's not overriding another spot there. Okay, Linda, that's all I have. I'm looking, are there any questions?
Does
I
not
don't.
look like we have any questions today. Just a
Okay.
reminder to everyone, though, you can enter any questions that you have using the Q&A icon on the top of your screen. We'll give it a couple of seconds to see if any questions come in.
Okay.
Okay,
I can switch back over
doesn't
here.
look like we have any questions. Just want to remind everyone again, if you are looking for more training, please check out our other learning options, which include documentation, tutorials, and walkthroughs, role-based training, additional training webinars, one-on-one virtual training, and on-site training or consultations. You can learn more at eyefinity.com/education. And with that, I would like to thank you, Tammy, for taking the time to share the administration settings. And thank you to all on the line for taking time out of your busy schedule to be with us today. This concludes our presentation. Thank you.